Golam Mostafa will show us the hospital facilities and academics in Kurgan. I think Mostafa, please. Yes, I can hear you.
Okay.
Please share your
Okay,
screen
okay.
and please keep a good judgment to the time, because we are already 2 hours just ending, and please have a good judgment to the time. Okay, you can start. And you know that the most interesting part of the presentation by our professor is just we are waiting for it, and I request the Kurgan fellow just go a little bit hurry.
Can you see my screen?
Yes, sir. I can see your screen.
Okay. Okay.
Yes, sir. Yes, sir.
Now I am talking about the hospital facilities and academics. Ilizarov Center, which is up to 2005, it was named as Russian Ilizarov Scientific Center for Restorative Traumatology and Orthopedic, or RISC-RTO. Kurgan is the capital of orthopedics. This is a city where the Russian Ilizarov Scientific Center is situated. Annually, over 10,000 patients with orthopedic and neuro-orthopedic conditions can receive treatment at the center. Consultation and diagnostic center there allows for 250 daily appointments to be made, and the hospital accommodates 800 beds. The strong team of the Kurgan Ilizarov Center is staffed with 1,500 highly qualified professionals, including 4 academicians, 10 professors, 34 doctors of medical sciences, and 93 candidates of medical sciences. Patients of any country and age group can apply for treatment at the RISC-RTO. The center incorporates an infection osteology hospital with a unique 40 years experience of managing most challenging cases of osteomyelitis. Joint replacement and of major and small joints, revision arthroplasty, prosthesis of lost limbs, orthosis of different types can be performed at the center. The Ilizarov Center offers extensive educational opportunities for medical students, residents, and postgraduate and practicing orthopedic surgeons with short and long-term training programs that exposes trainees to the latest advancement in orthopedic techniques. Unique discoveries and innovations of the research working at the Kurgan Ilizarov Center put the institute at the forefront of the Russian traumatology and orthopedics. Now come to the history. The history of the center started in the year of 1951 with an idea of external fixation device to repair bone injury, and it developed to the Federal Institution of the Russian Ilizarov Scientific Center that is known all over the world, and it bears the name of an outstanding orthopedic surgeon and innovator, Gabriel Abramovich Ilizarov. In 1966, Ilizarov was appointed head of problem laboratory. In 1969, the laboratory was reformed into the branch of the Leningrad Research Institute for Traumatology and Orthopedics, and in December 1971 into the Kurgan Research Institute of Experimental and Clinical Orthopedics and Traumatology. In 1987, the institute became all USSR, and in 1993, it's named as RISC-RTO. Since 2005, the official name of the center is the Federal State Institution, Russian Ilizarov Scientific Center for Restorative Traumatology and Orthopedics of the Ministry of Health and Social Development of the Russian Federation. Now, history of the Ilizarov Center Museum. It was opened on 15th June 1993. Professor V.I. Shevtsov, director of the center at that time, opened it during the International Scientific and Practical Conference. The main museum space is the former Ilizarov's study and office where he worked from 1972 to 1983, displaying his furniture, souvenirs, books, his first apparatus, and manuscripts. There are a lot of portraits on the walls painted by artists and former patients on their own wish, as Ilizarov never ordered any of his portraits. The other halls exhibit a lot of material on the center's history and activities. The museum was renovated in 2011 and uses computer technologies in demonstrating slideshows, films, and a great number of presentations. The museum has been already visited by more than 60,000 people. And this picture shows me at the museum where Ilizarov, Professor Ilizarov was at his office. And we are the fellows. At that session, we are 9 fellows, 7 from Bangladesh, 1 from Nigeria, 1 from India in the museum. Administration. Now the director of the institute is Alexander V. Bartsev. Former Bartsev. And former director was Professor Govin, and before him there was a Professor Sevtsov as director. And they are the deputy directors. Deputy Director for Legal Affairs, Deputy Director for Administrative Issues, Deputy Director for Scientific Work. The clinical departments. There are many departments. Admission Unit 1, Traumatic and Orthopedic Department, 18 departments there are. Bone Infection Department, 3 departments. Rehabilitation Department, Anesthesiology and Intensive Care, Consultative Department, and X-ray Department. And I mentioned in the introduction that anyone can consult with Ilizarov Center, and they consult 250 patients every day. And the procedure is to get the advice in the following ways: by phone in the international department, or came to the clinic for international consultation, or by emailing. You have to send your medical record, information, and images. Upon receipt, your application will be studied by a specialist, and the conclusion about the possibility to be treated at the center will be sent to your email address. You may also be asked to supply additional medical findings or images. And how to admit in the Kurgan Center. Guidelines for the patients. Step 1, you have to do application and post. Send the information to the Ilizarov Center. If necessary, additional data will be required by a doctor. And receive a letter confirmation from the doctor regarding details of treatment. The tentative cost and the duration of the treatment are indicated in the agreement between the patient and the center. Step 2, visa trip arrangement. Prepare an invitation for the patient and accompanying person provided by the Ilizarov Center to apply for the Russian entry visa. Apply for visa for the patient and the accompanying person in the Russian Federation Consulate in India. Purchasing airline tickets by the patient. Now step 3, arrival and admission. Admission to the hospital is possible only after complete payment of the amount indicated in the agreement. At admission, the patient is examined by a GP or pediatrician. Patient who receive complex of medical services on correction of lower limb disproportions and deformities are supported to undergo preoperative tests and examination at the Ilizarov Center. Now, international department. It was introduced in 14 July 1988. Now it is headed by Valentina. She is working as head of this department from 2009, and this chief interpreters. Activities of their activities are collaboration with the international companies, associates, and social and behalf of Ilizarov Center, organization of the Ilizarov training courses for foreign specialists, translation and communication of the foreign patients with doctors, participation of Ilizarov Center in the international conference, symposium, courses, translation during international conferences and congress, translation of the correspondence and documentations, cooperation with Federal Migration Service Office and issue letter of invitation, visa extension, registration, etc. Their service is in English, German, French, and Japanese language. And there are some research laboratories. There are 17 department, and it is in the experimental lab in the Kurgan Center. Now, training programs. There are 3 types of training programs available for the professionals: Ilizarov Mini Fellowship, Ilizarov Master's Course, and short-term training. Ilizarov Mini Fellowship, its duration is 26 days, and it costs $4,000. And Ilizarov Master Course, its duration is 10 days, and it costs $2,900. And you can also participate in short-term training accordingly, $390 per day. So it is expensive, quite expensive. And a program of training includes lectures, discussions of the clinical cases, and workshop, live surgeries. The training is conducted by highly qualified faculty members. And there shows the multimedia class session and practical classes. And they allow to scrub in operations. And if you wish to present your paper during your fellowship, you can present there. Every Friday there is a clinical meeting. In that session, you will given the opportunity to present your paper. Provide the center for fellowship. You should provide the center with the following data for the letter of invitation: scanned passport copy, place of birth, permanent home address and phone number, place of work, study address and position with the institution, dates of arrival and departure, and city where a visa will be obtained. And in 2020, there are scheduled for mini fellowship, 5 fellowship program, and 3 master's course. And there are some pictures with our respected teachers during fellowship period. And now the last honorary professorship. The title honorary professor of the Center G. Ilizarova is exclusive and is established as a symbol of recognition of merit and expression of gratitude to persons who contributed to the dynamic development, international recognition, growth of the prestige and well-being of the center, who made a significant contribution to the popularization of the method of transosseous osteosynthesis according to Ilizarov. The title of honorary professor is awarded by the academic council by secret ballot on the application receipt. The award ceremony of the nominees is held as part of the annual scientific practical conference, Ilizarov Readings. Among the insignia of the honorary professor, a mantle with the logo of the center, a confederate, a stylized badge, and a pass to the territory of the RTC-W2. And here the list of honorary professors. And I am feeling very proud that our professor, my mentor, Professor Mufakkarul Bari sir, was honored by honorary professor in 2013. He was the first honored professor in this subcontinent. So far till 2019, 29th honored professor there. Among them, 16 from Russia, 6 from USA, and 1 from Bangladesh, India, China, South Korea, Egypt, and Italy. And in his lecture, Dr. Arif says his dream, because the man who dreamed us to go to the institute is my mentor, Professor Mufakkarul Bari sir, and it's one day became true in 2019 when we went there for a fellowship. Now our dream is to be in the honored professor board in the future, that we can be honored like our professor, our mentor. So take home message: highly professional surgeons and researchers, modern equipment, unique techniques used for diagnosis and treatment of patients, comfortable conditions, and caring attitude of the medical staff greatly contributed to the successful work of the Ilizarov Center. We can take the opportunity to get treatment from the Ilizarov Center, and we highly recommended the world-class training program of the Ilizarov Center for your further development as a Ilizarov surgeon. So thank you.
Golam Mostafa, thank you for your brilliant presentation. Can you please stop the screen share? And
Okay.
Golam Mostafa just elaborate everything about the clinical department opportunities and other things. Even the patient, if anyone want to be a patient in the Ilizarov Center, how can he proceed? And the main thing is that for Bangladeshi surgeons who are government officials, usually we can get into the Russia by the visa one entry. Usually Bangladesh government have a memorandum with Russia. Bangladesh government official get 30 days entry in the Russia without prior visa, and you can get it on entry. And if you want to stay for 30 days, it is enough. For if you want to stay more than 30 days, you have to take the visa prior to your arrival to the Russia. So this thing you should keep in mind. And another important thing is that if you need any assistance, any information regarding anything of the Kurgan, with the 7 Kurgan fellow and also consulting with my professor Bari sir, we are always open for all to help you all. And now